Recording.
Hey everybody, welcome Monday night. I hope that you had a wonderful weekend and that you are ready to start sharing the message of Juice Plus with people that you know and love. And I am so excited tonight because I'm going to take you back down memory lane. It was about 25 years ago when, as a community, we started talking about changing the health of future generations by getting more and more families on Juice Plus. As the science started to come out, as we started to realize how easy Juice Plus was to absorb, as we started to see, reductions in inflammation and what this was doing even at the level of gene expression, that message started to become clearer and louder, changing the health of future generations. And so where's the best place to start? The best place to start with changing the health of future generations is in utero. It's all about helping women have the healthiest pregnancies, because if they do, then they're going to have the healthiest babies. And what a great way to start your life with this kind of nutrition. So tonight, we're going to feature an amazing health lecture by Dr. Pohl. Dr. Pohl is a board-certified OB/GYN from Lawrenceville, Georgia. He has delivered thousands of babies. His program is educational, it's inspiring, and it's spot on. Here's a doctor that understands the connection between nutrition and disease, and the connection between nutrition, healthy babies, and Juice Plus. So Kathy, if you want to take it away, we're going to roll this amazing health lecture.
I welcome you to tonight's webinar entitled Vine-Ripened Babies. You're probably wondering how we came to this title, and I want to give credit where credit is due. Dr. Doug Odom, who's from Jackson, Mississippi, did a similar talk about 15 years ago, and I spoke to him a couple weeks ago, and I've basically resurrected this. I hope I do his talk justice with maybe some
Not sure. Let's restart this then.
I welcome you to tonight's webinar entitled Vine Managed Every Complication You Can Imagine. And what really concerns me and my colleagues and our government and all of the CDC and many of our medical organizations is that the maternal death rate in America is the highest in the industrialized world, and it's rising. Now, there's many reasons for it, and we're not going to solve them all tonight. Some of them have to do with access to care, but from a nutritional standpoint, whether you your small local hospital has closed and now you have to travel 100 miles to go to your doctor and go to the hospital. Even in that situation, you can do many things nutritionally, especially micronutritionally, to manage your pregnancy and hope for an optimal outcome. So we're going to talk a lot about nutrition and babies. And so I hope you'll have some content here and be able to spread this message to women who are childbearing, who are thinking about having a pregnancy, or maybe are pregnant and now want to optimize their pregnancy. I will have some solutions for you before this webinar is over. So I'm sure when you woke up this morning, you probably did not imagine you would see a picture of a baby on the same page as a tomato. And so the whole concept here of Vine-Ripened, let's talk about produce. And I'm actually a hobby farmer, so I've grown lots of tomatoes. So this subject is also very near and dear to my heart. And to have the optimum quality with produce, like with tomatoes, you do not want to pick them unripe. And so ripeness really begins at what's called the breaker stage. So tomatoes, as they start turning color, they start turning red fairly quickly. And we know that 50% of our produce gains its nutritional value in the last few days of growth. So unfortunately, many companies pick their produce and pick their tomatoes unripe, they're green, and then put them on a truck. They travel for an average of 1,200 miles, and they show up in the grocery store red. They may look pretty, but I'm sure you've had a tomato that has absolutely no taste and tastes like cardboard. And that's a good example of an unripe tomato that just doesn't have the nutritional value that's supposed to. And so you want to pick your produce at the first signs of changing color, breaker stage or later, so they're fully ripe and have all the nutritional contents in it. And babies are no different. To have the optimum health of a baby, you really want to take the baby to term. And I don't know of a pediatrician on this planet that doesn't believe that getting to 39 weeks really is absolutely critical. Now, the definition of term is 37 weeks, and most OBGYNs will not stop a labor after 35 weeks, but still, optimum health really is close to the due date or at least 39 weeks. And every pediatrician will tell you, babies that have were born after 39 weeks, they tend to feed better, they sleep better, they're less irritable, and as they get older, they tend to have fewer health problems. They actually go see the doctor less often. So this concept of getting to term, whether you're growing tomatoes or whether you're growing a baby, is very similar. So therein lies the title Vine-Ripened. All right, so if getting to term is very important, let's look at the major roadblocks to getting to a vine-ripened pregnancy. And there's 5 big ones: infertility, miscarriage, preeclampsia, preterm labor, and fetal growth restriction. Now, infertility and miscarriage doesn't really have to do with the actual pregnancy itself, but just for completeness sake, I wanted to include it here. And it's obvious that if you have trouble getting pregnant, you're not going to get to a term pregnancy. And if you miscarry, you're also not going to get to a term pregnancy. But about 10% of couples have fertility problems. And of those 10%, about 10% are unexplained. And the solution for most of those is just in vitro fertilization. How about some micronutritional strategies? Miscarriage, about 20% of pregnancies miscarry. Most of them are genetic, like 80%, but 20%, up to 20% are unexplained. Are there some nutritional things that you can do to optimize your pregnancy and not miscarry? And then the final 3 things, your preeclampsia, preterm labor, and fetal growth restriction. Preeclampsia is a hypertensive disorder that spans an entire spectrum from just mild blood pressure problems to really serious problems like HELLP syndrome and severe preeclampsia that really threatens the mother's life and many times requires early delivery. And that dovetails really nicely in with preterm labor, especially if the preeclampsia causes you to have to deliver the baby early to save the mother's life. And about 10% of pregnancies, especially if it's your first pregnancy or you have a new partner, you're at risk for preeclampsia. And we believe the problem lies in the placenta, but again, it really is mostly unknown. And preterm labor, especially if it's spontaneous, about 10% of pregnancies end up in preterm labor. And again, we think there's a problem with the placenta, but again, it's mostly unknown. And fetal growth restriction, when the baby doesn't grow properly, most of the time it's associated with a hypertensive problem like preeclampsia. And if preeclampsia is unknown, then fetal growth restriction related preeclampsia is also unknown. So you can see unexplained, unknown, and unexplained is the theme that runs through this roadblocks to a vine-ripened term pregnancy. So if we could undo some of these things, we would have more pregnancies go to vine-ripened term. Just focusing on preterm deliveries, it's very stressful to not just the baby that's in the NICU, it's also stressful to the parents. The mother and the father have to visit the sick child. So that is very stressful to the parents. And according to the World Health Organization, 10% of pregnancies around the world still end up delivering early. And in the United States, we've actually seen a 30% increase in the last 25 years. So what's going on there? And we know that about 28% of all neonatal deaths in the first 7 days of life are due to preterm birth. So again, we could cut down a lot of those neonatal deaths if we could cut down on preterm births. And again, the most common type of preterm birth is spontaneous and of unknown etiology. And the vast majority of preterm births occur to women who have no risk factors or low risk factors. So if we don't know what causes it, and we don't know what the risk factors are, we need to develop a strategy that really goes to everybody because we can't identify who's at risk. So in the British literature at obstetric medicine, there was an interesting article in 2016 where they drew attention to oxidative stress in pregnancy and reproduction. And they said that there is overwhelming evidence for oxidative stress causing harm in reproduction. And lo and behold, look, they mentioned these 5 things that we just finished talking about: infertility, miscarriage, preeclampsia, preterm labor, and fetal growth restriction. And they concluded that there was sparse evidence that supplementing with antioxidants does anything. And they're basically talking about prenatal vitamins. So what are we supposed to do? Well, we will come to that solution here shortly. Another article in the Frontiers in Immunology that was a review article published in 2014 looked at oxidative stress damage as a detrimental factor in preterm birth pathology. Again, remember, I mentioned that we don't know why most of these women have preterm birth, but maybe we finally have some little insight into this. And so they reported here that oxidative stress causes damage to the fetal membranes of the placenta, which promotes fetal aging, which then causes uterine contractions. Now that's normal if it's a term, but it's abnormal when it's preterm. So now we have this mechanism that oxidative stress damage are likely triggers for labor. And if it's preterm, we don't want that to happen. So let's talk about nutrition. And you're wondering, what's that engine doing there? Well, we're going to talk about macro and micronutrition, and we're going to liken it to the gasoline and oil that you put in the car. The gasoline that you put in the car to make it run are like the macronutrients that you eat every day: proteins, fats, and carbs. It gives you energy. And then the oil in the car are the micronutrients that we frequently overlook. Those are mostly found in fruits, vegetables, and berries, the phytonutrients and antioxidants that are frequently overlooked in our general health and in our nutrition. And that's like the oil that goes in the car. And you know that if you neglect the oil and all you do is keep putting gasoline in the car, it's going to run. But if you neglect the oil, don't fill it up, change it periodically, your engine, just like your body, is not going to run at peak performance. And a pregnant woman growing a baby is no different. So obviously, when you're growing a baby, and to get to that kind of optimal average weight of 7.5 to 8 pounds a term, it requires macronutrients. Yes, they are very important. And again, like the gasoline that goes into the car, it's the proteins, fats, and carbs that go into what's called normal oxidation, or the Krebs cycle. And there we make energy so that we can actually function. But a normal byproduct, again, a normal byproduct of this normal oxidation are free radicals. And free radicals are reactive oxygen species that are looking for trouble. And we just mentioned how oxidative stress is linked to all these reproductive problems. So where are these reactive oxygen species, these free radicals, made? Well, they're made in these little cells called mitochondria. And These mitochondria are little organelles that are inside every cell, whether it's a placenta or a fetus growing or the mother's liver or brain cell. All cells need mitochondria, and these little ovoid-shaped organelles, and that's where we make energy. That's also where we make these free radicals. So free radicals are so bad, and oxidative stress is linked to poor health, and now we think it's also linked to harm in reproduction. What is it? Well, it's basically free radicals that are not getting neutralized, or this imbalance between pro-oxidant and antioxidant capacity. And an easy way to conceptualize it is to take an apple or a banana, cut it in half, and leave it exposed to air, maybe put a little lemon juice on one half, come back in about 3-4 hours, and on the side that you didn't put lemon juice, it's going to look brown. It's kind of a sign of aging, and that's oxidative stress, just like a person that's aging and gets wrinkled skin. And so we know that oxidative stress is linked to poor health and harm in reproduction, and it does that by attacking DNA and proteins. Many of these proteins are enzymes. They're very critical to normal metabolism and function. It also attacks cell membranes, and you know that that can't be good for anybody, especially for a pregnant woman growing a baby. Now, most pregnant women are told to take a prenatal vitamin. So they either go over the counter or they go to a pharmacist and they get a prenatal vitamin. But is that the solution? Do we have a vitamin deficiency or a whole food deficiency for our pregnant women? So let's look at vitamin supplementation in pregnancy. Let's look what the literature shows. This was a wonderful review article published just in July of 2016 in the Drug and Therapeutics Bulletin. And they basically said, we looked at many different prenatal vitamins. It's usually a constellation of 20 plus vitamins and minerals. And they found that only folic acid had really strong evidence that you need it. And vitamin D may be less clear-cut for supplementation. And so they concluded, we found no evidence to recommend that all pregnant women should take prenatal vitamins, except for maybe folic acid and maybe vitamin D. And they concluded good nourishment, both before and during pregnancy, is essential for the health of the mother and the unborn fetus. Let's look at another review article on prenatal vitamins in 2013 on the benefits and risks of various nutrient supplements. And they again concluded that vitamin and mineral supplements, prenatal vitamins, cannot replace a healthy diet. It's not enough high quality data to even recommend prenatal vitamins to all women. And that folic acid, again, was the only vitamin that really needed the supplementation. It was the only one that had any definitive evidence. And there are some at-risk populations that are told that they need definitely the prenatal vitamin, but maybe this is the group that actually needs what's going to be coming later on in the webinar. And these are our adolescents and women carrying multiple gestations and so forth. So by now you realize that pregnancy is an oxidatively stressed journey. It's a 9-month oxidatively stressed journey. And let me just show you how stressed this is. So we're going to talk about several different physiological changes that occur during pregnancy. First and foremost, a pregnant woman gets nauseated, and that causes oxidative stress. It affects her breast. It has to enlarge in preparation for breastfeeding, and that causes oxidative stress. Her respiratory rate, her resting respiratory rate increases to accommodate for respirating for herself and this unborn child. Her kidneys increase because it needs to clear all these metabolites of just not her and the baby. Her cardiovascular system undergoes significant changes. Her blood volume actually increases by 50%. To pump all this around, your cardiac output has to increase, your heart rate has to increase, and to accommodate all this blood flow, your blood pressure actually needs to drop. And so these are stressful changes that cause oxidative stress. There are metabolic changes. Pregnancy tends to increase your glucose levels, and so there's hormones that are in place, like human placental lactogen, that bind insulin receptors that has this tendency to increase your glucose, again, to feed this growing baby. If this goes beyond normal, then you have something called gestational diabetes, and that also will create more oxidative stress. And we know that the uterus has to enlarge, that increases the blood supply there. There are tremendous hormonal changes that affect the immune system. And then there's all these musculoskeletal changes. The lordotic curve that then causes center of gravity changes and pressure on the back and back pain. And then all that increased weight on the weight-bearing joints, hips, knees, ankles. All that causes oxidative stress. Now, all these changes are normal physiological changes, but they lead to oxidative stress. And we now know by now, if this is unchecked and uncleared, it may cause a bad reproductive outcome, which we want to avoid. I mentioned that hormone changes affect the immune system, and this is a complex slide, but let me just summarize it for you. The immune system in a pregnant woman is temporarily suppressed, and it's done that to prevent harmful immune responses to a growing baby because it has immunological data in there, DNA that's half from the father and half from the mother. So it's amazing, it's a miracle that it doesn't get rejected, and it does that by temporarily suppressing the immune system. Now that puts the pregnant woman at risk for infections. So later on in the webinar, we're going to talk about how it's important for the woman health to be optimized to prevent any kind of infections. And we know that growing a baby from ounces to a 7.5-pound baby requires macronutritional support, and all this causes oxidative stress. Remember, proteins, fats, and carbs, they feed into the oxidative metabolism, and a normal byproduct are free radicals. So we now know that oxidative stress is linked to poor health and harm in reproduction. So what's the solution? Well, the solution is antioxidants and phytonutrients, and those are mostly found in fruits, vegetables, and berries. Now, before we talk more about nutrition, let's talk about a few other special pregnancy conditions that lead to even more oxidative stress. So if you have twins or triplets or even a higher multiples, you have enhanced oxidative stress. And we know that exercise is wonderful for pregnancy. It lowers the risk of developing gestational diabetes. It helps with weight control, reduces postpartum depression. So we want pregnant women to exercise as long as they don't have a contraindication to exercising, like hypertension or preterm labor, and their doctor put them at bed rest. But we know that if a woman exercises in pregnancy, especially if she does CrossFit, she'll have additional oxidative stress. And we know that the journey of pregnancy causes oxidative stress. How about the delivery process? Look at this lady lifting weights. The next time you see a woman pushing a baby out, her grimace on her face is going to look like this lady clinging and jerking 300 pounds, and she's sweating and she's working hard. That causes lots of oxidative stress. And let's not forget about the baby. As the baby's coming through the birth canal, its head needs to mold, and it basically goes from a round shape to a more elongated shape. And it's not just the soft tissue in the skull that undergoes changes, it's actually the brain inside that elongates. And so it's not unlike a boxer that goes through a boxing match. Wow, that baby certainly is going to have some oxidative stress as it's going through labor. So we know that delivering a baby is an athletic event for both the mother and the baby, and it raises oxidative stress. So the miracle of childbirth is amazing, and labor increases the oxidative stress for both mother and fetus. And if you add to that labor plus a cesarean delivery, or just a cesarean delivery, you can imagine the oxidative stress associated with an operation. So we know that pregnancy is an oxidatively stressed journey, and delivery is an oxidatively stressed process. So what did Mother Nature give us to neutralize all these free radicals so that we don't have all this oxidative stress and minimize our risk for developing preeclampsia and preterm labor and fetal growth restriction? Well, it's this antioxidant enzyme cascade, and it looks very complex, but to make it work, we need the micronutrition, primarily of fruits, vegetables, and berries. And so Hippocrates, who lived 400 BC, he said, "Let food be thy medicine and medicine be thy food." Wow, what wisdom. We need to re-embrace this, not just for pregnant women, but for everybody. So what are these micronutrients? We're back to the engine and the oil that goes in the car. And they are vitamins and minerals. They are no doubt important. Vitamins are organic compounds from plants and bacteria, and except for vitamin D, you need to get that in your diet. And minerals are like calcium and iron. You need that. These are inorganic compounds from the earth, and you need that in your diet. But guess what? There are only 13 vitamins and 16 minerals that are really critical to function. What about antioxidants and phytonutrients? Who supplies them? Let me give you a hint. It's Juice Plus. And antioxidants, there's 100,000 of them. They're smaller molecules, and the phytonutrients are larger molecules, about 12,455. So if you add the 13 to 16, you got 29 versus 112,455 antioxidant phytonutrients. You know that we are not deficient in vitamins. We are deficient in whole food. And we know that this is only available in plant-based nutrition. So what are these phytonutrients? Well, the plant world already uses them to thwart off competitors, predators, and pathogens. And it's the rainbow of colors in the grocery store. And they are the vegetables and fruits with all the different wonderful colors. And they are not just antioxidants, but they also are anti-inflammatory. And that theme will become very critical here shortly. And they go by several names like carotenoids and flavonoids. So to build your healthiest baby, I suggest we look at Juice Plus, because this may be really the missing key to the puzzle, the missing piece to the puzzle. So what is Juice Plus? Other than being the solution, it is protein. It's fruits, vegetables, and berries that are grown in small to medium-sized farms across the country. And the history has it that Dr. Santillo, a naturopath, his dad was diagnosed with cancer and decided to juice for him and noticed the health benefits of whole food. And so that's how Juice Plus was born. And I mentioned the importance of vine-ripening your produce, especially tomatoes, and you want to get a baby through 9 weeks. Juice Plus makes sure that all their products are vine-ripened. And if you're childbearing, with this topic of pregnancy, the lemon peel and the vegetable blend and the fruit blend meets the minimum requirement for folic acid, folate, by the March of Dimes to reduce the risk of a neural tube defect in your baby. And so we now know that this constellation of fruits, vegetables, and berry blends bridges the gap of what we should eat and what we actually eat. Now, if you know me by now, there's probably no webinar that doesn't at least mention the microbiome. And so let me just mention a couple of unique things that are just on the cutting edge that we're just starting to learn about. We now believe that the placenta in early developing fetus are no longer considered germ-free, that actually there's early microbial colonization of the placenta, and that will shape the baby's, the infant's microbiome and subsequent childhood health. And these are all the health benefits that most pediatricians have noticed. And so leaky gut or microbial dysbiosis is linked to unhealthy pregnancy complications. Now, this is about all that we know right now, and future research will probably start linking metabolic, hormonal, and immune changes of pregnancy together. So if our gut health is so important, especially for pregnant women, what could she do? Well, Juice Plus has a macronutritional component called the complete shakes, which are powders and also bars. And they are loaded with fiber. And this is important to feed your gut microbiome, to keep it healthy, to keep from developing leaky gut. And this is relevant for everybody, including pregnant women. Now, the cornerstone of the complete powder is non-GMO soy, and Juice Plus chose that because it contains 9 of 22 essential amino acids, and it also has 14 other superfoods in it, and they are vegan and non-GMO, gluten and dairy-free, and completely plant-based. And anyone that may have heard that soy may be linked to breast cancer, again, Juice Plus uses non-GMO soy, which is only about 5% of all the soy that's grown in America. And there is no credible study in the literature that links non-GMO soy with any kind of breast cancer or any other cancer for that matter. So this is safe for anybody. About 20 years ago, pregnant women were told to take a fish oil product because the brain, Dr. Bill Sears reminds us, is 60% fat. And fetuses need a steady diet of essential fatty acids, just like young children and even adults. So what did Juice Plus did? It did a very amazing thing and bypassed the fish and went straight to the algae, berries, and oils to create this completely plant-based omega blend. So now we can give this to pregnant women and not worry about any kind of contaminants like mercury, which actually is a neurotoxin. So Juice Plus blend is not just good for heart, joints, skin, and eyes, but it's absolutely critical for this developing brain, which is 60% fat. And it's a constellation of 5 different omegas, and again, no contaminants, so you don't have to worry about mercury. And Juice Plus developed this very unique technology called cold pressed, If you look at most fish oils, in order to purify them, they actually heat the fish oil, which then destroys the omegas, and that's not good. So these are never heated, and so the omega blend, all the fatty acids are intact. So Juice Plus is very unique. It's not a vitamin, it's not a mineral. It's actually an extension of food. It has a nutrition label. It's loaded with phytonutrients. All the products are non-GMO, dairy-free, gluten-free, and they are NSF certified. Recently, the Cornucopia Institute is attacking the whole concept of being organic, and they've noticed that organic is basically just a paper trail and an honor system, and nothing actually gets tested. So NSF-based certification basically means that all the products of Juice Plus have been tested, and so you know that it doesn't have glyphosate in it or found in Roundup. There are no genetically modified seeds, and so you know that this is safe for pregnant women and for children and for athletes that frequently get tested for doping. And the other aspect that makes Juice Plus very unique compared to any other supplement company is the research that backs it up. There's almost 40 published studies now in peer-reviewed prospective randomized journals. And that puts Juice Plus in a very exclusive category of less than 1% of supplement companies that have their products certified and researched. It is the most thoroughly researched product in the world. This is a listing of several of the universities that have done these prospective randomized studies. And what has the research found? Well, the research has found many things, but let me highlight the things that are most relevant to a pregnant person. We know that oxidative stress is linked to poor reproductive outcomes. So the Juice Plus research has shown it reduces oxidative stress, and that's wonderful. We also know that when a pregnant person first gets pregnant, there is an inflammatory response, and Juice Plus will support this healthy inflammatory response. We know that a pregnant woman's immune health, her immune system is blunted to not reject this fetus. So Juice Plus supports her immune health. We also know that many preterm labor cases may be related to poor dentition and poor gum health. And so Juice Plus supports healthy gums and may reduce this whole preterm labor epidemic that we have going around the world. And finally, we know that Juice Plus improves the metabolism in overweight boys and reduces and reverses insulin resistance. And that would be wonderful to support the metabolism of a pregnant lady that has this tendency to become gestationally diabetic. Just a final reminder, Juice Plus is not about treating or curing any specific conditions. And this mostly has to do with the ICD coding system. We used to have 13,000 codes. Now we have 68,000 codes with the new ICD-10 modification. So think of Juice Plus as the highly concentrated food additive that is helpful and plant-based nutrition. So in summary, the Juice Plus solution for pregnancy is to reduce the oxidative stress associated with pregnancy and delivery, to reduce those complications, to fortify the antioxidant enzyme cascade, to neutralize free radicals, to bridge the micronutritional gap between what we eat and what we should eat. Remember, only 1 out of 10 of us actually eat the minimum 7 servings per day, and pregnant women are no different. They face the same challenges that the rest of us do. We want to bridge the gap of today's lower micronutritional value of our produce. Broccoli today is not the broccoli of yesterday. The broccoli today compared to 30, 40 years ago is probably about 40% of the nutritional value, so we actually need to eat more. And Juice Plus will support the essential fatty acid requirements of the developing fetal brain. Remember, our brain is 60% fat, and we need a steady diet of these essential fatty acids. And we also want to support the oral, placental, gut, and vaginal microbiome. And collectively, this is all to optimize the pregnancy and birth experience. So I encourage anyone that's thinking about getting pregnant or is pregnant or knows of someone that's pregnant, encourage them to make one simple change for their pregnancy. They're going to have a much healthier pregnancy. I believe it is the prenatal vitamin and omega blend of choice because Juice Plus is simply macronutrition, scientifically proven, highly concentrated, affordable, and convenient. So that concludes my webinar. I hope you found this subject fascinating as I find it fascinating. And please spread the word to pregnant women that there is a nutritional supplement that is much better than taking just a prenatal vitamin. I'll wish you all a blessed evening.
Wow.
Wow, wasn't that a powerful lecture? Just no, I'm sorry that that would not stream into Transform 2021, but that is a recorded lecture. You all have access to it. If you need that, we'll make that available to you. We'll put the link also on all of the pages, the Zoom link to this program. And I learned so much the first time I watched this, and I just took copious notes. Important nutrition for our pregnant moms. And I'm just so proud that we get to represent a program like Juice Plus. So anybody have any questions before we say good night?
I didn't get his specialty. Did anyone note that? Is he an OBGYN also?
Yeah, he's an
Okay.
OBGYN. Yes, he is.
Thank you.
Yeah. Pretty amazing. And I'm so glad that we have this. That we have this as a resource for education. So thanks for being with me tonight. It's been wonderful. And once again, have a great week, everybody. See you next Monday night.